Hello, everybody. Today, the session is going to be very interesting one because we are going to discuss about different pathways that are available for international medical graduates who want to work as a doctor in UK. And with us, we have Dr. Raja Adnan Ahmed, who is doesn't need any introduction, who has been helping international medical graduates from various platforms who want to work here in UK. So, thank you so much, Dr. Raja Adnan Ahmed, for giving us your time, precious time.
Thank you, Dr. Shoaib, for inviting me. And I'd just like to start by saying that I really appreciate all the things you have been doing online as well. As a young doctor, you have created a platform with medical education resources for medical education and also health education. It's quite very, very impressive.
Thank you so much. Without a further ado, let's start. So, my first question is a very simple question. How an international medical graduate, especially from Pakistan, can work as a doctor in UK?
So when you are thinking about working in any country as a doctor, you need to think about that. How do I get the license to practice or registration of their medical council? So in UK, the medical council is General Medical Council, the GMC, which we know about that. And then there are several pathways, several different pathways how you can actually get on to get GMC registration. So for a junior doctor, the one who's just graduated, or have done internship or house job only, the most common pathway people have been using is PLAB exam. PLAB is an exam which is conducted by the General Medical Council, and it is a licensing exam. It gives you the license to practice. If you pass the exam, then you will get the GMC registration license to practice. So this is one pathway, but that is not the only pathway. This is an important thing to consider that a lot of international medical graduates might not know about this, that on the GMC website, they have also given a list of what they call the acceptable postgraduate qualification of different UK institute and also some foreign institutes as well. Unfortunately, in foreign institute, Pakistan and India are not in that list, so none of our qualifications are accepted for registration, but there are some others. For UK qualification, like for example, if you've done exams for Royal College, like MRCP, MRCS, MRC Psych, uh, all of these MRCOG. So there's a whole list of different specialties Royal College exams. So if you have passed that, then based on that, and after passing that exam and getting your English exam, you can get GMC registration. So that is another route. And people always ask me this question. You might ask me afterwards that which route is more superior? Should we go for PLAB or for membership exam?
Hmm.
But then there's a third route which is called MTI. Now
Hmm.
MTI are limited posts which are advertised either by a trust or by the Royal College itself. Because I know in some Royal Colleges establish MTI schemes. I know about Royal College of Psychiatrists is running an MTI scheme. Every year they recruit, advertise an MTI through their own website, recruit through Royal College themselves, interview and recruit. Then Royal College of Gynae's got one as well. I'm not sure about other Royal Colleges because I haven't checked them. But there are some trusts, they also advertise MTI scheme. Basically, MTI means that it's called Medical Training Initiative, which means that if you are accepted for that post, you will not only get a job for 2 years, but they will also sponsor your GMC registration. So that
Hmm.
is another route people use to come in. But as I said, these posts are limited and they are for usually for specialists, somebody who already has experience in their specialty. They are not for people who are fresh graduates.
Is it for
And
people who are already in training, or is it for non-training people with experience as well?
no, I think when, like, if you go on the Royal College of Psychiatrists website, they would expect their ideal candidate is somebody who's training in their home country
Hmm.
as a psychiatrist. So the idea is that during your training of FCPS training or whatever training you're doing for India, you can come to UK and spend 2 years here to gain
Hmm.
experience, and then you can go back. But
Hmm.
then people who come for 2 years, their registration is permanent. So technically, they don't have to go back. They can actually continue to sort of uh, apply for other jobs and continue to stay in UK as well. So that is something people have used in the past to
Hmm.
gain registration as well.
Okay.
So these, so,
Sorry,
sorry,
continue.
yeah. So these were the three more common pathway. But then you will always also hear about something called sponsorship pathway as well, which is also there, but this is sort of less common. It's mostly for people who have more experience, like specialists in their field.
Hmm.
So basically, on the GMC website, again, you will find if you search the GMC sponsorship pathway, the page will come, which will have a list of hospitals that can authorize a sponsorship of your registration. So if a hospital is uh, is really wants to employ you because you are somebody who has the skill set they want. Like for example, if there's a psychiatrist they really want to hire from abroad, they can apply for their GMC registration to say to GMC that we are happy with the skill set of this person and we like to employ them and we like you to we like to sponsor their GMC registration. So this route is not as easy as people think. If this route was that easy, then people will stop doing the Royal College exams and they'll stop doing the PLAB. So this is mostly used by people who are more specialists,
Hmm.
and only if there is a shortage. Because if the hospital is already getting people who have registration experience, then they will not try to recruit somebody like this directly from outside and take a risk.
Of course. Yeah. So that is a great news that it's not only like one pathway just to do
Yeah.
PLAB and get registered. There are multiple pathways that people can avail. So I have two questions. One, where they can find more information. You mentioned that it's all on the GMC website, but if they have queries, there are certain individual queries. If there is
Yeah.
any platform or anywhere where they can find answers to their queries.
So I know because everybody will have their individual circumstances, and people ask questions around their individual circumstances. I would say that there's a lot of freely available information out there. You
Hmm.
can, I like to mention this IMG group, which is there. If you go on Facebook, you're going to find the IMG group, and you will find this group of doctors who uh, are helping each other there for free. You can post a question there. They people would answer according to their experience. There's a lot of people who are actually quite experienced now in their own specialties, working in UK for a number of years now, actually helping the junior doctors and giving them the advice. So that is one of the things. And then it's like platform like yourself. I mean, I myself have a YouTube channel as well, so I try to post videos on questions on topics which people repeatedly ask me. So I
Hmm.
try and make some videos around that, and sometimes I interview, like you interviewing me. I have done some interviews with other individuals as well who are experts in their field, so to give some guidance. So I would say that there's a lot of guidance available nowadays that you can actually find people through internet, through YouTube, through Facebook, genuine people who are actually working in UK. But I would
Hmm.
also like to warn that don't get defrauded, because there's another risk that you can get uh, you can get into trap of of speaking to somebody who started to ask you for to say that you need to pay for their advice and all that. You don't need to do that. You can always find people who are helpful.
Of course, there are a lot of free information and people who are ready to help, especially
Yeah.
like your kind. And I think you do have a platform which is really great. And I have watched a video where you mentioned all these pathways in very detail, and you also showed the website where they can find the information and where they can get, the where the jobs are posted as well,
Mm.
the vacancies. That's really good. I'll put a link down there whenever I post this video. And I'll also put a link to the International Medical Graduates for UK group as well. I think they are really helpful for anyone who wants to move to UK and need some information. My second question is, which pathway would be the best for international medical graduate to come to UK?
So I think this is a very important question because yeah, like for example, people ask me that if I have should I go for Royal College exam or should I go for PLAB if I can get registration through both. So
Hmm.
I will always say that always the Royal College exams were always the more superior pathway. So, for example, if you can do MRCP, MRCS, MRC Psych, depending on whichever specialty you're working in, if you can do that exam, full exam, not just part one, then that exam itself is a qualification. PLAB itself is not a qualification. PLAB is just a licensing exam.
Hmm.
Having a stamp on your CV that a Royal College has approved taking an exam from you, including the MCQs and practical exam, and they are happy with your skills and giving you a certificate like MRCS or MRCP, that gives a lot of more weight on your CV when you're applying for jobs in UK. So although PLAB will also get you registration, MRCP will also get you registration, but your CV when they go in front of a hospital, person who has done MRCP would be rated higher. You can say that, but
Hmm.
I can understand it's not everybody's. It's not everybody doesn't have that level of experience to actually be able to do those exams, and because they're harder. Again, I have to warn the membership exams are actually harder than the PLAB exam. PLAB is relatively simpler because PLAB
Hmm.
is checking your knowledge as a level of a house officer, foundation
Hmm.
doctor, what we call in UK, just
Hmm.
somebody who's just done MBBS, kind of final year MBBS level exam. Something when you're doing MRCP, MRCS, MRC Psych, they are checking your knowledge as somebody who's done training at least for 2 years, 3 years in that specialty. So the depth of knowledge required is actually higher.
Hmm.
So that is something we need to be mindful of.
So for a fresh graduate who is just fresh, like has just done a house job, nothing else, so probably PLAB would be a better option. But
Yeah,
they should be mindful that because of the situation that we will discuss later about the
yeah,
job saturation and everything, they should opt for other exams and they should be open for other options as
yeah.
well. Okay, that's great. Now, the next question that is really important when someone tries to move to another country, one of the major factors that contribute to this decision is the financial aspects. Like, what would they make as a doctor when they move to another country? So, can you give a rough estimate? What would be their pay when they come to UK as a junior doctor or a specialist or a
Mm.
consultant?
I think that's a good question. I think question, if I can widen this question, if you don't mind, that people ask me that, why should I move to UK? I'm
Hmm.
talking about the Pakistani. I can relate more to because I'm a Pakistani, but I'm sure other developing countries will have the same thing. So it's
Hmm.
not just the money. I always say to the people, what our mistake is that I'll certainly convert. I will certainly find out that the SHO, a junior doctor in UK, earns around 3,500 or 3,000 pounds. So I'll directly convert that. This in Pakistani money that is around 12 lakh, 15 lakh per month. That's just too much. But they don't factor in the fact that they're actually not living in Pakistan. You can come and live in UK as well, and then all the uh, everything becomes so expensive, and expenses go up, and this thing. But so the question is that what are the advantages of moving to UK basically? So it's not just that you will get better money
Hmm.
if you compare coming from Pakistan. It is that the quality of training, the working hours are less, the exposure you get in UK, the recognition of training across the world. So if you get training from UK, you will more recognized in countries like Australia, Canada, Middle East. You can get higher pays if you want to move from UK to those countries. Then there's another factor is that you can also get the British passport as well.
Hmm.
And I know some people will say that this is an anti-national thing to say that you just want to move away out of, so you can change the color of your passport. But it is sometimes very, very important that if you want to become international workforce and you want to explore different parts of the world, it gives you more advantage. It opens more doors for you. It
Hmm.
also not just you get the British passport, but your family also get that, and then your next generation will have more opportunities. So some you can say that they will have more doors open for them, from the employment point of view. So it's not just that you have to look at the quality of training. You have to look at the time spent in training. How will you factor in that? The working hours, the time you're getting to spend with your family. Because I think UK doctors are spending more time with the family, because I can compare them with what I see in Pakistan. Um, in terms of what you earn, so one of the things which sometimes is difficult for grasp in Pakistan is that UK has a like a, what we call a socialist kind of system for NHS,
Hmm.
which means that everybody is getting paid the same. So a consultant psychiatrist salary is same as what neurosurgeon is getting from the basic salary for what they're getting from. Obviously, people do other things,
Hmm.
private work and all that to add on things. But as a junior doctor, when you come, I think you can probably tell more than what you're earning. But around when you start here, you can around 3,000 pounds, 3,500 pounds, and all be around how many on calls are you doing, and if you or
Hmm.
how much locum opportunities are there, because you can add on your income.
Hmm.
Then when you become registrar, it goes up to middle grade doctor, 4,000, 4,500. As a consultant now, it's crossing uh, above 5,000, 5,000, 6,000. But by the time you become a consultant, you have more options here. It's not just that it's just one job you're doing. You have the option of doing some private work on the side. You have the option of giving some extra time within your hospital. You
Hmm.
have a option of getting some extra sessions from your hospital as well. So people end up earning more than what is actually on offered to them, on the basic salary scale.
Hmm. Yeah, that's true. And what is your final verdict? Are people who come to UK financially, are they better off as compared to people who work in Pakistan? Or I mean, I'm talking about general, like
Yeah,
on average. I know there are loads of doctors who are really experienced and they earn
yeah.
lots in Pakistan as well. But on average, what would you say?
So for a junior doctor and a middle grade doctor or doctor in training, definitely your lifestyle and your salary will be more what you're getting in Pakistan and what you get in UK. So that is one thing. As a consultant level, as you said, there are some examples in Pakistan. Whenever whichever specialty you go to the top. You see go and
Hmm.
see a top psychiatrist in Pakistan, see how much they are earning, and they say they must will be earning more than what I am earning here.
Hmm.
There's no doubt about that, and will be by that is a different level. So at a consultant level, I would like to just say again, say a lot of people nowadays are using UK as a destination, as not their final choice of to live. They're actually using UK as like a launching pad. So they're coming here, doing their training, getting CCT, getting British passport, and then they're looking for other opportunities outside because then from at the concern level, they're getting better packages. If they're even going to Republic of Ireland, if they're going to Canada, they're moving to Australia. Every week, one of my friends or one of the extended um, you know
Hmm.
people I know, they contact me and tell me I'm moving to Canada, I'm moving to Australia. They go to Middle East as well, from Saudi Arabia, all the rich countries in Middle East, and then they get quite good salary, from there. So at consultant level, I would say that in comparison in the Western countries, if you're comparing, I'm not comparing it with what people are doing in Pakistan, but in the comparison with the Western countries, the consultant salary in UK is not as good as what you will expect in America or Canada
Hmm.
or Australia.
That's true. But you have multiple avenues and you can go anywhere if you have a qualification from
Yeah,
UK. Okay, that's great. Now, the other query that I get quite often is how difficult to get into the training for any
yeah.
specialty. I know there are people who come here and they most of the time they work as a non-training doctors and then they enter into a training. And now the situation is getting difficult and people are really worried that if they move to UK, will there be any training opportunities there or will they be just stuck as a junior doctor, as a non-training
Yeah.
doctor here?
So there are certain areas, when there are saturation. When you use the term saturation, which means that a lot of people have done that particular thing, and then they're trying to go to the next stage. So that's why there is saturation. So for example, I'll give you the first hurdle is not passing the PLAB exam. I think the only hurdle with PLAB exam is getting the date, because the dates are not as frequent, and sometimes you have to wait for months and months, and as soon as the date open, you need to apply.
Hmm.
So passing PLAB itself is not a difficult exam, but after passing PLAB, if you are a junior doctor who has gap on their CV or who just have an internship, in that market, there is a lot of saturation, because there's a lot of people who've done PLAB, especially after 2020, after the COVID, when the immigration rules were relaxed from 2021, then people can apply for more jobs, for more training and all that. After that, a lot of IMGs came here. There was like quite a lot of people doing PLAB and all that. So that gave created a lot of saturation.
Hmm.
So first thing people are struggling with nowadays is to find the first job in UK. So whenever they're applying, they will finding that they hospital asking for NHS experience, they're asking for NHS exposure. So this is the first hurdle. But once your foot is in the door, what I say to people, that once you got your first job, and the first job, you need to keep an open mind. I keep mentioning this to a lot of people, that first job, don't worry about where it is. Like, people ask me, can I go to Scotland? Scotland, Northern Ireland, Wales, rural
Hmm.
area, small hospital. Don't hesitate, because you need your foot in the door. And same with the specialty as well. If you don't want to become an A&E doctor, but you're getting the first job in A&E, apply for everything if you're a junior doctor. After your first job, once you have the stamp of NHS experience on your CV, so the next hurdle is the CREST form, what we call the Foundation Competency Form, which you can get signed from within UK, and sometimes from back home as well. That makes you eligible basically to apply for training. So after internship, they expect you to have 12 more months of experience anywhere in the world. If you have done that experience back home, that's good. If you don't have done not done it back home, then within UK, that will make you eligible to apply for training. Now then, as you said, it is becoming more competitive in training as well. For example, in the past, MSR exam, anybody who passed MSR exam will almost had the certainty that they will get either the GP or psychiatry. If they apply for GP or psychiatry, they were
Hmm.
almost certain if they passed it, they will get it. But
Hmm.
nowadays, it's not the case. They need actually good scores on that.
Hmm.
Then afterwards, as I said, it's a long topic, that how do different specialties recruit. So
Hmm.
Psychiatry and GP is just based on MSR exam. You apply and then you invited to take the exam. But then other specialties like IMT, core surgical training, radiology, all of those other ops and gynae, they may have MSRA as part of the recruitment process as well, but then they are expecting other things as well. They are expecting some achievement on your portfolio, things like research, things which are good on your CV. So it's not impossible. I wouldn't say. I mean, I have in the last 3 or 4 years, I have seen people getting all kind of trainings, IMGs, like yourself, uh, getting into all kind of training, including GP, psychiatry, and ops and gynae, radiology, and on my YouTube, I try and interview them as well, just to give some inspiration to the other IMGs, that to say they can see somebody like them and actually got the training. It's not impossible, but I would say definitely, as you use the term competitive, is definitely becoming more competitive. You need to be more mindful of understanding the recruitment process.
Okay. So the competition has increased and it
Yeah,
is becoming increasingly difficult. Although it's not impossible, people are still getting into training. And I think many people, I don't know anybody who yeah, there are certain specialties which are really difficult and really competitive, but most of specialties they are okay if you do have a good portfolio, then you are okay to go for it. You might take an year or so to build your portfolio, to build your CV, and then you apply for the training and get it. But given the competitiveness, do you think it is still a wise option to move to UK, especially for someone who is not, let's say, not happy with the current situation back in the home country and they want to move to somewhere? Then they
yeah,
haven't decided yet, but they want to move
yeah,
to somewhere where the training is good, where the money is good.
yeah.
So, do you think UK is still one of the best options for them?
So I think this is a good question, because this is a very basic question people will ask me. I mean, I'm sure they're asking you as well. That I am just a recent graduate. What are my options? What can I do? So they are
Hmm.
look. If you look at different countries and different countries' exams, Middle East, people consider that as an option as well. But Middle East, there's a bit, again, there's a saturation there as well. Getting a junior doctor job is not that easy. They are more looking at people who are already trained, who are more specialists. There are good jobs in Middle East, but that is one issue. Then the other thing with Middle East is that they don't actually give you the nationality and passport, and you don't actually get training in Middle East. Most of the time, you don't get any training. Although I've heard now some countries have opened some degree of training, then you will be responsible for your own training. People are sitting in Middle East and doing exams of UK and all that. If you can get a job, if you one of those people who just want to get out of Pakistan and get a job in Middle East, I would say, as a stepping stone, go for it. Don't hesitate. But that's usually not the final place people stay in.
Hmm.
If you compare it to UK, as I said, the PLAB exam is easy. The issue is finding a job after PLAB. uh, AMC is an Australian exam. That is actually what I've seen, is that it is a bit harder than PLAB, and it's more expensive as well. And
Hmm.
again, if you just done AMC, you might struggle to get job in Australia. But otherwise, Australia is a very good place, for training,
Hmm.
for IMGs, for to work there as a senior doctor as well.
Hmm. Okay.
Canada is another place.
Hmm.
Canada has their own licensing exams as well, and even I've seen people who have Canadian nationalities, Pakistanis who have Canadian nationalities, who went to Canada, did their exams, and they still don't get a job. Because the job, the what we call that the training jobs there, you have to directly apply for training. The training jobs are actually less there. That's just what, and my understanding is. So it is, despite you having Canadian passport, you can struggle there. Then you come to US. Basically, I would say the reason I was giving you all this lecture is to build it up to US, and
Hmm.
say that if you if you are a if you can afford US Assembly, and if
Hmm.
you are somebody who has the time and you're intelligent, anybody intelligent who can contact me from Pakistan, and I'll look at the CV and find that impressive, I always advise them to go for US Assembly,
Hmm.
because that is still the most superior path. Again, there is an issue. Not everybody who does US Assembly will get a job in US. There are people who will struggle to find a match. But
Hmm.
if you get a match in the US, is if you've put the right amount of effort and you can afford that process, because not just about taking US Assembly. People go to US and do some observerships and all those things to get the reference from there. If you can find a match, that is the more superior pathway. People,
Hmm.
I don't know if it was a question. People ask me that should I go for PLAB or USMLE. My advice is always that if you can afford and go for USMLE, time by the fort financially, then that should be the main pathway. So I will to answer your question that PLAB I think is still looking at UK is still a worthy enough pathway, but you just
Hmm.
need to be mindful that just doing PLAB does not mean that you will have 100% guarantee a job. So you need to have a plan B in your mind as well.
Hmm. Okay. I know that people struggle financially, and whenever they are making a decision to move to another country, they always think about the finances. And I think in the past, when people were choosing PLAB, one of the main reasons was the exams are relatively easier, and financially, it's not that much burdensome as compared to
Yeah.
USA. But I would always say that it is not just about I mean, it's not the money that is going to be wasted. It is the money that you are investing. And like any business, it's just like a business. You are investing in it. And then when you get a job there, you get a training, you will be well off and you will earn loads. Yeah,
So I mean, if you get a job, then within 2 or 3 months, all the loans you have taken, all that. I mean, I hear stories from international medical graduates a lot. People have like sold the jewelry of their mother. People have taken loans from their uncles and aunties. People have sold their cars, things like that, to actually to come out of to actually afford
Hmm.
these exams. So people are, most people, we have to understand, most people who are doing MBBS, especially from the medical colleges, the government medical college, are actually from middle class families.
Hmm.
So
True.
they are not people who have got 15,000 pounds just in the
Hmm.
bank.
That's true. Yeah. Um, so if someone has done a PLAB examination, passed and got the GMC registration, are there any opportunities if they're not getting any job here in UK? Are there any opportunities in any other countries on the basis of this GMC
Yeah.
registration?
So this is another very common question people ask, that are there any other opportunities, because they have done PLAB, but they are frustrated that they are not getting job. So one thing I would like to mention here, this Australia has this route, what they call the competent authority pathway, which means that if you have done PLAB, but also they will expect you to have done 1 year of job within UK. That could be a
Mm.
training job or non-training job, but 12 months post GMC registration experience through PLAB, not through the Royal College exam. So if you have done that, then you can apply for the AMC, and then you AMC will be exempted, which means that you can directly then apply for a job in Australia and as a junior doctor and then go. And I know many junior doctors have done that, including from Pakistan as well,
Hmm.
gone to Australia, using that pathway because they felt it was cheaper than just doing AMC and then taking that. But just doing PLAB and you don't have anything else in UK experience on your CV, uh, I have heard. I mean, I haven't met anybody who's done that, but Middle East, they say that the exams of UAE, they can be exempted if you apply for
Hmm.
jobs and then tell them that you have GMC registration. The hospital can give you the consideration. So people have actually told me that this is an option. Um, I'm not sure what is the job situation like for junior doctors in the Middle East.
I have spoken to one of the doctors who is working there, and he mentioned that actually PLAB for PLAB people who have passed the PLAB and got GMC registration, they are exempted for the tests that are conducted in UAE, and the job prospects are also good as compared to those who haven't done their PLAB exam,
Yeah,
because they prefer that you have at least done something that is
yeah.
from the foreign country. So I think there are better prospects, although the competition has increased recently, but still there are better
Hmm.
opportunities there. Okay, Dr. Adnan, the last question. Do you have any tips? I know there are many people who have done their
Yeah,
registration
yeah.
and they're waiting for their first job. Are there any quick tips? I know it's a long discussion,
No,
but
it's a long.
just to
It's
conclude this session, are there any tips where they can,
uh,
land to a good job
I
relatively
I
quickly?
I have been advising people nowadays that when you are looking at PLAB, don't look at as a way that once I get GMC, I fast pass PLAB, once I get GMC registration, a job is actually ready waiting for me. I will
Mm.
always ask them that you need to have a plan B within your home country as well. So if you are, for example, graduate in your home country, try and start training in your home country as well as if you can, and don't put gaps on your CV if you can avoid the gaps, because in UK recruitment the gaps can look bad on your CV as well. So if you if you've done PLAB and if you're not getting job, at least start working in your home country.
Mm.
Start doing things like, taking exams. If you're interested in medicine, take MRCP part 1, or relevant courses and all that. Because when your CV will go in front of a recruiter, if a CV is like this, some person has just done internship, after that there's a gap, then they've done PLAB, and after that there's more gap. This is one CV, and the second CV is that somebody has done internship, then they start to work in the home country, then they've done PLAB, and then still continue to train in the home country, and now done MRCP part 1 as well, and bit of research, whatever. So that CV will actually look superior to the first CV I mentioned. This is why I've said to the people, just in your mind think of the worst thing that can happen, that after James you won't get job in UK. So you need to have a plan B ready, that in your home country your skills are not getting wasted. You are developing new skills and all that, and continue to work.
Okay, so the final verdict is just continue progressing. You shouldn't stop like
Yeah.
you have got the registration and now you should get a job. You should continue progressing. If you are interested in a particular specialty, just appear for the exams, prepare for them, do the relevant courses and audits and all the things that you have mentioned previously in your videos. I'll put a link down and about your channel and all the other relevant information that people can find. Thank you so much for your time. I think it was really an informative session, and anybody, any doctor who wants to move to UK, it will be an informative session for them as well.